Welcome to the Unhealthy Podcast, where we cut through the nonsense and talk about what really affects your health, your diet, your fitness, your stress, relationships, and the mental games in your own head. I'm Uncle Marv, and this is your Straight Shooting Health Newscast. Today, we're breaking down the latest headlines so you can tell what's just hype and what actually matters. Let's get into today's top stories. If you've been seeing online clinics offering Ozempic-like shots for weight loss, this one's for you. The FDA just sent warning letters to 30 telehealth companies for illegally marketed compounded GLP-1 drugs. These were done without proper approvals or safety review. These outfits were advertising them for weight loss and sometimes diabetes care, even though the compounded versions were not FDA approved and can vary in potency and quality. The agency says some products use untested salt forms, and many companies skipped key risk information in their marketing. For adults turning to quick-fix weight loss meds, this is a reminder that online and easy doesn't always mean safe, regulated, or evidence-based. If you're considering or using a mail order or telehealth GLP-1 shot, verify that it's an FDA-approved product from a licensed pharmacy, not a compounded imitation sold like a supplement. Ask your prescriber exactly what you're getting and how it's sourced. If the company can't clearly explain approval status and side effect risks, that's a red flag to walk away. So for a show called Unhealthy, this might be one of the most quietly important stories of the week. HHS announced that 53 medical schools have pledged to increase nutrition education time in their curricula starting this fall. Right now, many physicians get only a handful of hours of formal training in diet and nutrition, despite chronic diseases tied to food choices driving much of today's illness and spending. The initiative, backed by HHS leadership, aims to prepare future doctors to give more detailed, practical guidance on diet as a core part of managing conditions like diabetes, heart disease, and obesity. For patients who've heard eat better with no follow-up, this could eventually change the conversation. If you felt your doctor doesn't know what to say beyond lose weight, you're not wrong. Many weren't trained for detailed nutrition counseling. Over the coming years, newer physicians may be better equipped to talk specifics. In the meantime, asking for referrals to registered dietitians or structured weight programs is a smart move. A new survey suggests Americans are losing confidence in some of the country's top health institutions, and that could have real consequences for public health. Researchers at the University of Pennsylvania's Annenberg Public Policy Center surveyed U.S. adults in February and found trust in agencies like the CDC, FDA, and NIH has dropped between 5 and 7 percentage points over the last year. Interestingly enough, Americans still trust their personal doctors the most, about 86%, and the independent medical organizations like the American Heart Association and the American Academy of Pediatrics ranked higher than federal agencies. Public health experts say declining trust could make it harder to manage future health emergencies, vaccination campaigns, and disease outbreaks. Trust is a huge factor in whether people follow medical advice. The takeaway here is simple. Build a relationship with a doctor you trust and rely on credible medical organizations, not random social media posts when making health decisions. Speaking of social media posts, AI chatbots are becoming increasingly used for emotional support, but new warnings suggest they could actually make certain medical conditions worse. Researchers and clinicians say some chatbot systems may unintentionally reinforce paranoia, mania, or delusional thinking because they tend to validate user statements rather than challenge them. Experts worry that people struggling with severe mental illness may treat chatbots like therapists, even though they aren't trained mental health professionals. Mental health organizations say AI tools can be helpful for basic support or journaling, but they should never replace licensed mental health care, especially during a crisis. AI can be helpful for reflection or information, but it's not therapy. If you're struggling with serious mental health issues, a licensed therapist or counselor is still the safest and most effective option. A new investigation is raising concerns about what's actually in the food we Americans eat. Researchers found at least 111 chemical substances that have been added to foods, drinks, and supplements without formal FDA safety review. The issue involves a loophole in the GRAS systems, short for Generally Recognized as Safe, which always allows companies to determine on their own whether certain ingredients are safe. Advocacy groups say some of these substances appear in thousands of products across the U.S. food supply. Public health advocates are now calling for stricter oversight and transparency in food ingredient approvals. This doesn't mean that food is unsafe, but it does highlight the importance of reading labels and choosing minimally processed foods when possible. Your biological age, or how old your body actually functions, may matter more than your calendar age. A new study suggests people who keep their biological age lower than their chronological age may significantly reduce their risk of stroke and cognitive decline. Researchers have found that improving the gap between these two measurements was linked to better brain health outcomes. Biological age can be influenced by lifestyle factors like exercise, sleep quality, diet, and stress levels. Scientists say the concept could become a major focus in future longevity research. And finally, a new study suggests combining a ketogenic diet with regular exercise may improve blood sugar levels. Researchers found participants following a keto diet while exercising experienced improvements in blood glucose control and aerobic exercise. The findings could be important for people managing type 2 diabetes or metabolic syndrome, conditions affecting tens of millions of Americans. However, experts caution that keto diets aren't right for everyone and should be monitored by healthcare professionals, especially for people with existing medical conditions. That's your health rundown for today. If you heard something that hit home, pick one small change you can act on this week and tell a friend about the show so they can do the same. I'm Uncle Marv, and this has been the Unhealthy Podcast. Stay curious and stay stubborn about your health, and be sure to live healthy and be happy.